Hey, welcome back. And again, thanks a lot for joining me today. My name is David Kunashko. I'm the medical director here at BioFlex Laser Therapy headquarters in Toronto, Ontario, Canada. So just before we get started, a little bit of housekeeping. These webinars and all the webinars that I do are recorded, and then we edit them, and eventually we upload them onto our website. So you can always watch it again there, or for future webinars, you can go to our website to find them, or if you prefer, as long as you register for today's webinar or any future webinars, you will be sent an email with a link to watch it again within a week or so of the original broadcast date. And also, too, you can always ask me questions, and so it's always a little bit better to actually join in live if you can, because at the end of every session, I open up for Q&A, and you can ask me your questions. Certainly, you can type them into the Q&A box at any given time, and I'll address those questions at the end of the session. So feel free to do that. Today's topic is interesting because I'm using the terminology red light therapy. And the reason why I'm using that is because that is the most common sort of phrase to describe light therapy that's used by most people. And by that, I mean not necessarily researchers or medical professionals, healthcare professionals, more along the lines of what you'd see in social media, advertisements, even how marketing is done as well. And so I wanted to touch on that because, you know, everyone hears about red light therapy and not really understanding sort of what it is, or, you know, is it just red light? And there's so many questions and so many interesting, how should I say, claims made by different companies and social media influencers or what have you. And some are accurate, some are not accurate, some are completely out to lunch. And unfortunately, the way these things are done is that there's a lot of confusion. So I'd like to try and clear that confusion up with today's webinar. Okay, let's hope I don't cough all through this webinar. So what I'd like to do today specifically is chat a little bit about the origins of red light. Now, I'm going to use the terminology of red light therapy throughout this webinar, but you'll soon learn that that's not really the correct terminology, but that's okay. I'm going to talk a little bit about how it works, what you can potentially use it for, and that's going to be based on research, not on some, you know, Instagram influencers' take on it, right? It's going to be based on randomized controlled trials that have shown efficacy to treat a certain condition. That's what I'm basing it on, not anecdotal evidence or someone told someone that it could cure, I don't know, whatever. I'm going to base this on good foundational research science, which I think everyone can appreciate. Then I'll talk about the safety aspects of red light therapy, a little bit about understanding medical devices, because that's where the picture gets gray a lot for a lot of different manufacturers and people buying these devices, not understanding what it is they're buying. And then, okay, so now that you've maybe understood a little bit about it, now sort of if you're interested in maybe pursuing it for treatment, then what should you look for? And any other questions you have at the end of today's sessions, I'm more than happy to answer them. So as far as light therapy goes, you know, the history goes back thousands of years. And typically, the use of sunlight or heliotherapy was used a lot for a natural treatment of a lot of skin diseases or skin issues. In fact, there's evidence going back well over 3,500 years that ancient Egyptians used sun exposure to treat vitiligo, which is a loss of skin pigment. Now, modern phototherapy. Now, phototherapy is the use of artificial light. It didn't come into existence until the latter part of the 19th century. And some early observations by Arthur Downes and Thomas Blunt found that specific wavelengths, especially ultraviolet, played a role in sterilization of bacteria. They did this in test tubes and so forth. And they realized that it might have a possibly medicinal effect on trying to sterilize equipment or what have you. And of course, nowadays we know that ultraviolet's used as a disinfectant. You know, if you have water that you want to disinfect or sterilize or what have you, ultraviolet's oftentimes used. So you can understand where that's kind of going. And then a little bit later in the 19th century, in the turn of the 20th century, there was a physician by the name of Niels Finsen. Now, he was born in the Faroe Islands, which is a group of islands in between Denmark and Iceland. And he got interested in light therapy for the story goes is that he was pretty sick as a young man. And when he was out in the sunlight, he always felt better. His condition seemed to get better. So he, as a physician, a young physician, he started to kind of experiment and look into the effects of different wavelengths of light. And eventually he started to look at the effects of blue wavelengths, ultraviolet wavelengths, and even red wavelengths, and used for common conditions at the time, including smallpox and skin tuberculosis. And you can see the pictures of Niels Finsen in the upper left here, but also the equipment that he used. And the lower one is one of his actual devices. It's a brass arc lamp with different filters inside of it. And he got very successful. He actually published papers in the British Medical Journal and the Lancet. If you know the journals, medical journals, these are very high impact factor, well established and well-known journals. Now, he won the Nobel Prize for his work in phototherapy in 1903. He died shortly thereafter. Now, the picture that you see here is his portrait for the Nobel Prize in Medicine or Physiology. And he died of Pick's disease. You know, that's why he was sick as growing up as a young man. So he died prematurely, but his work did spread, not just in the sort of the Nordic countries of Europe, but throughout the world as well. So he's considered one of the sort of the four founders of what we now consider to be, you know, sometimes called red light therapy. This progressed into the 1960s when another physician by the name of Andre Mester started using lasers in research in 1965. And that was just about 5 years after development of the very first laser made by Theodore Maiman. That particular laser was a high-powered ruby crystal laser. And you can see a picture of it here. I don't know if you can see it clearly or not, but you see this ruby crystal rod, and then it's surrounded by a high flash fluorescent tube. That's what the first lasers looked like. And in fact, they were very powerful. So they would cause ablation or heat production when they hit things, including skin. So physicians back then were starting to use these lasers to eradicate and ablate or remove tumors, initially in animal models and then eventually in humans. So Mester decided to carry out some experiments using this ruby crystal laser. Now note that the wavelength is red, 695. Now, isn't that interesting? Because that's how this whole red light therapy thing started, because the very first laser happened to be from a ruby crystal where the wavelength was red. It just was serendipitously discovered by Andre Mester. So what happened was that he tried to eradicate tumors that he actually sort of did incisions in the bellies of rats, put in tumor cells, and then he tried to, you know, eradicate the tumor. But what happened was his laser was calibrated much lower than he actually wanted. So instead of ablating or removing the tumor, he noticed that the incisions made to implant the tumor cells healed faster compared to the control. So he was quite surprised by his discovery. Number one, whoever made the laser for him kind of screwed up. But number two, the fact that this low-powered red laser that didn't generate any heat actually had some type of metabolic effect on the cells that were trying to heal after an incision or a wound. So he then went on to carry out lots of other experiments, including on skin defects, burns, human cases of ulcers arising from diabetes and venous insufficiency. Infected wounds also seem to heal faster in response to laser treatment. Here's one example. So what he did was a skin flap wound case or cases on the bellies of rats or abdomens of rats. He'd shave off the fur, the skin. He'd cut little flaps in the control with no light, and he'd observe how long it would take to heal. He did the same, but on one of those wounds, he irradiated it with that low-powered ruby crystal laser. And if you look at the time frame, you can see now these pictures are taken at the same time frame, same size of wound, and you can clearly see the laser-treated wound is healing much faster than the control. What was also noticed by Mester was that the adjacent wound to the red laser-treated wound was also healing faster compared to the control, even though it wasn't touched by the red light. So Mester concluded a couple things. One is that this red light has some type of metabolic or photobiomodulation, which is what he coined the term back then, effect on wound healing directly on the cells that were affected. This effect can also be mediated or carried in the blood in a remote or systemic effect in adjacent areas, which is why you see the adjacent wound also healing faster. So to this day, what's really important about using red light therapy is that it's going to provide a direct effect and an indirect or systemic effect. And the advantage of that is that it's carried by the blood to deeper areas of the body where the light can't actually reach. And by the way, if you have any questions at all for me, please ask, and I will get to them at the very end of the webinar. So since Mester first uncovered the therapeutic value of red light, different wavelengths of light have also been shown to promote healing of skin, muscle, nerve, tendon, cartilage, bone, and even dental tissues. Studies have shown healing tissues respond positively to appropriate doses of light, and especially light within the wavelengths of 600 to about 1,000 nanometers. I'm going to talk a little bit about the wavelengths as well as we go along. So evidence suggests that low energy light speeds up many stages of healing as it accelerates inflammation, promotes fibroblast proliferation. Now, fibroblasts are cells in your body that produce collagen. So it actually enhances the synthesis of type 1, which is mature collagen, and type 3, which is progenitor collagen. It also accelerates bone repair and remodeling and promotes revascularization of wounds and accelerates tissue repair. So let's get to the naming terminology. Red light therapy. That's what you hear about. That's what everyone searches for. And that's why I put it on the title. However, there's probably 70 plus names, acronyms that have been used for this type of therapy. I don't want to get into naming all of them, but there have been many. Several years ago, two of the major associations for light therapy, the World Association and North American Association, got together along with all the key researchers in the field, and they came up with a more accurate terminology. And they refer to it now as photobiomodulation therapy, or PBMT. So nowadays, if you look for research, they're not going to use red light therapy. They're going to use photobiomodulation therapy, or PBMT. The previous acronym was not even red light therapy. It was low-level laser or low-level light therapy, or LLLT. And the reason why they changed the terminology is that lasers, while they have good properties and may be very effective for this phenomenon, you can use other sources of light, including LEDs, including fluorescent bulbs. And I see your questions, and I will definitely get to them at the end. Keep typing them in, and I'll get to them for sure. Type them in the Q&A box, folks, not in the chat box. So this phenomenon isn't restricted to lasers. And anyone that says you have to use a laser to get this type of healing effect, unfortunately, they're either not being truthful, or they don't follow research, or they don't understand the concept of photobiomodulation. Now, the new definition, as I mentioned, photobiomodulation therapy, this comes directly from, not from me, from the World Association, that it's a form of light therapy that uses non-ionizing forms of light Okay, so that means it's not dangerous. And it could include lasers, LEDs, broadband light, like big fluorescent bulbs, in both the visible and infrared spectrum. It's a non-thermal process. In other words, you don't want to have heat or a lot of heat being generated. So the power of each diode should be under 500 milliwatts, because anything above that creates lots of heat and it will burn your skin. So the idea here is not to produce heat. It's not a infrared heating thermal pad for feeling nice. That's not what this is about. This is about specific photochemical or photophysical reactions that occur inside a cell that help you heal. And it can help with reducing pain, reducing inflammation, modulating your immune system, and promoting healing of wounds and tissue regeneration. So how does it work? Well, first of all, we need to understand what happens with inflammation, right? Inflammation is what you're trying to resolve. Acute, subacute, chronic inflammation. If you have pain, you have inflammation. And unfortunately, the way our bodies are designed is that inflammation is usually excessive and can be prolonged. And did you know, by the way, that last year they published a study at McGill University that found the correlation between taking NSAIDs, like Aleve, right? If you take those NSAIDs, non-steroidal anti-inflammatory drugs, for acute pain to give you some relief, it does not allow inflammation to resolve. Instead, it blocks it temporarily. When it blocks inflammation, it can't resolve. So you're at a greater risk, 2 times a greater risk to develop chronic pain because you took a pill or took a whole bunch of Aleve to give you temporary relief, and then you wonder why you're not getting better. Okay, so stop with the Aleve, stop with NSAIDs. They do not help you heal faster. Yeah, as you can see, I'm not sponsored by Aleve, by the way. So what happens in inflammation is a buildup of nitric oxide. It's a byproduct of inflammation. Nitric oxide, I can speak for hours on it. Nitric oxide in high concentrations inside the cell displaces oxygen that allows for cellular respiration. In other words, you need oxygen to produce ATP, which is of course, the energy molecule produced by mitochondria to allow cells to do what they should be doing, which is repairing and regenerating. When you have excessive nitric oxide due to inflammation, you inhibit oxygen from binding, and now ATP levels go down, and you start to produce what's called pro-inflammatory mediators, interleukins 1, 6, COX-2, and these promote inflammation. And guess what? You don't want that to happen. You want to minimize the effect of nitric oxide. That's what light therapy does. Now, let me explain this. This diagram is pretty intense, so I'm going to walk you through it. And by the way, I'm going to talk not just about red light, but some other wavelengths. Let's start with red and near infrared. These 2 wavelengths are known to affect the mitochondria, specifically an enzyme that promotes ATP production called cytochrome C oxidase. When that light interacts with cytochrome C oxidase that is being temporarily inhibited by nitric oxide, it actually has enough energy to boot off the nitric oxide and allow oxygen to bind back on. By doing this, you allow the mitochondria to start to do what they should be doing, is increasing ATP. Now, you see red light therapy all over the place. It says, oh, it increases your energy. What it does is it normalizes your energy. It doesn't do anything crazy to your mitochondria. It just helps prevent the negative effects of inflammation on the mitochondria. So by doing that, you increase ATP in the cell. Now, this nitric oxide is really potent vasodilator, and it is freely diffusible through the membrane of the cell into your blood. So now this nitric oxide that was once inhibiting cellular respiration is now in the blood, in the localized area you're treating, and it causes vasodilation. By the way, if you don't understand vasodilation, this is where your blood vessels dilate. You know, the makers of Viagra made a lot of money by vasodilation and slow release of nitric oxide. And I think you can fill in the gaps there as to what I'm talking about. Okay, so nitric oxide, that's one of the effects, is vasodilation. The other effect of red and near infrared is increased ATP. Then you have secondary messengers, which I won't really get into a lot. It gets kind of complex, but eventually these secondary messengers, because now you're producing ATP, has a protective effect on the cell, and your cells produce what's called stress proteins to protect them against further damage. So it's trickle-down effects that take some time to occur. Light therapy or red light therapy the effects don't happen immediately. It takes a while for these cells to start to respond. Now, let's look at some other wavelengths. A little bit higher in the near infrared, over 900 nanometers. These affect what's called heat or light-gated ion channels that control calcium influx into and out of a cell. Now, calcium can provide signaling inside a cell that has positive effects as well. So a little higher wavelengths may also have a positive effect, but not the same way as I've described by red and near infrared. A little bit farther infrared is what I'm talking about, over 900 nanometers, because that's what's targeting these specific ion channels. Blue light. Now, blue light's interesting because it has lots of really good positive physiological effects that can be helpful for treatment of acne, for skin lesions and skin issues, because it doesn't penetrate very deeply, but its mechanism is a little bit different as well. And it uses what's called cryptochromes that have an effect on the cell itself by producing or having an effect on transducing cellular signals, which again gets uber complicated. And there's other wavelengths too, like green light, which can have an effect on what's called opsin channels, again, controlling ion exchange inside a cell, which can have positive signaling pathways into the cell. So nowadays, we're looking at all sorts of other wavelengths that might be helpful in different mechanisms. The main one that you hear about, is ATP and the powerhouse of the cell and so on and so forth. That's only part of the picture, okay? So that's essentially how this is working. Now, to get into a little bit more detail, and again, I won't spend a lot of time here. Here's the red light coming here. Here's cytochrome C oxidase. The nitric oxide, NO, you can see here, is bound to copper and to iron subunits in the cytochrome C oxidase, and it prevents oxygen from binding. So when the light comes in, it displaces nitric oxide, that exits the cell, allows oxygen to bind back on, and now you start to have a bit better metabolism of the cells trying to repair. One of the key things about understanding red light therapy is how much light should you use? And that's where 99.9% of devices out there completely fail, because they just give it to you and say, go ahead and try. And oftentimes they're not working because you have no idea. You don't know the power. You don't know the energy density. You don't know how much energy you should be using. It gets super confusing. And that's because there's something called a biphasic dose response. A biphasic dose response is when you have no or very little light, it's just not enough to cause an effect. So if you use something too weak, like very weak lights, zero effect. Doesn't matter how long you have it on your body, you ain't going to get nothing to happen. That's good English there, right? Now, as you start to increase photobiomodulation or increase the power of the light, now you're starting to see photobiomodulation or positive effects on the cell. And eventually, if you have enough light, you reach an optimal amount. That means you feel better. You're healing quicker. You're seeing those results. That's the dosage that you want to get. But if you overdo it, there starts to be diminishing effects. And if you really overdo it, you actually can aggravate things, okay? So the key thing here is having the correct dosage. Now, how do you know that? Well, that's the whole point. How do you know that? You're either going to sift through a lot of research and figure this out, figure out the power, figure out the surface area, figure out the energy density of your equipment, do all that, and you could probably do that. But it's a little bit easier if you use devices that have an understanding of dosaging, a history of using it in clinical research and obviously in the hands of medical practitioners that understand the dosaging. So all you have to do is select the specific dosage for what you're trying to treat. If you do that and or try different dosaging with clinical support, then you'll be much likely to have better results. The other thing that I should talk a little bit about is how light interacts with skin. Now, light, oh, by the way, I'm going to go way over time here. I just realized that I'm on at 12:40 and this is going to take a while. So get out your popcorn or come back a little bit later and you can watch the recording. But when light hits skin, it reflects off. When light touches skin, more is absorbed. When you push the light into the skin, even more is absorbed. So most research uses what's called a contact technique, where the light diodes touch the skin. If the light diodes don't touch the skin, they tend to reflect more of that light off, and therefore you need much higher power and dosaging, like these big LED panels. But then it gets very difficult to figure out what the dosage is at the skin, because it could be 10 inches, 12 inches, 8 inches. I mean, I don't know. It makes a little bit different. So when you're using these big LED panels, they tend to be used more for wellness, kind of overall systemic effect, and not to treat your bursitis of your elbow, for example. I would never use an LED panel to treat a medical condition, a specific injury, because the dosaging is just too many variables. So you need to know the dosage at the appropriate depth. Too little does nothing, too much may be suboptimal. And remember, there's two types of effects: direct effect, where light's absorbed directly by the injured or inflamed cell, and indirectly, when it's absorbed by white blood cells or stem cells or platelets that get activated and are carried in the circulation to injured cells deeper in the tissue to help them repair or improve their healing. Now, if you go to the research, and I did this today, by the way, I searched for PBMT or LLLT on PubMed. You can see the website I use down here. And I clicked on randomized controlled trials. I found 1,226 randomized controlled trials on red light therapy. Of course, that's PBMT or LLLT. So there is lots of good randomized human clinical trials on many different types of conditions or injuries. When I search PBMT or LLLT and I look at the entire spectrum of research, that pulls up 8,357 papers. So these are animal model studies, human studies, test tube studies, all of that combined, well over 8,000 studies. This phenomenon of photobiomodulation or red light therapy is extremely well researched, but we still need to learn a lot more. What can you use it for? Traditionally, it's helped for musculoskeletal rehabilitation, muscle injuries, ligament injuries, tendon injuries, cartilage tears, joint degeneration, bone issues, bursitis, inflammation of joints, contracture disorders. These are inflammatory conditions that will respond to light therapy if you use the correct dosaging and correct wavelengths. It's also used a lot in nerve injuries, compressions, neuropathies, neuralgias, nerve healing in general, things like spinal stenosis. And you'll see it used a lot in skin conditions, especially red and blue light, acne, eczema, dermatitis, psoriasis, rashes, herpes. I mentioned vitiligo earlier. It can be helpful to reduce swelling from lymphedema, improve circulation and vasodilation, as I mentioned earlier. It can have an effect on stem cells and white blood cells. And it can be used in wound healing. That was one of the first indications back when Mester started to research it. So ulcers, canker sores of your mouth, oral herpes sores, post-surgical healing, burns, lacerations, bruising. These all have an inflammatory component and a wound tissue healing component that light therapy can be very helpful for. And lastly, this is the one that I see so much in social media about, and that is skin and its aging, its anti-aging effects. Okay, is it true? Absolutely. Is it a replacement for cosmetic surgery? No, but it's safe, no side effects, and there will be demonstrably observable effects on fine lines and wrinkles and skin turgor pressure or appearance of thickness of skin if you use correct dosaging on the skin for a period of time. Now, I'm not talking a few days, I'm talking many weeks or months. That's when you start to observe the effects. Okay, so some critical things. These are all actually verifiable, accurate uses of photobiomodulation. Now, we get into some tricky things. Alzheimer's, dementia, post-concussion syndrome, autism, depression. Is there research on this? Yes. Is there a lot of research on this? No. Lots of animal model research, some promising human clinical trials. Absolutely. In fact, BioFlex is sponsoring one right now on post-concussion syndrome for the use of BioFlex for the symptoms of PCS. Now, that doesn't mean that we have enough knowledge yet to, number one, make any claims. And I'll talk about claims coming up shortly as well. Can it be used for inflammatory gastrointestinal issues? Probably. Is there a lot of research on this? No. Are there case studies and anecdotal evidence? Absolutely. Is it worth trying? For sure. Can you make a claim? Not necessarily. Pelvic inflammatory disorders, dysmenorrhea, even fertility issues, all I've been seeing research in these fields as well. And in fact, we're sponsoring a trial in the University of Ottawa using light therapy specifically for vulvodynia, and we'll be shifting towards dysmenorrhea as well. So the research is accumulating. The thing about red light therapy is that, first of all, you need to understand how to use it to get any result. And then if there's inflammation, oftentimes it will help. How safe is it? It's extremely safe. Now, my sort of notation here references using lasers, because in physiotherapy, oftentimes they do use lasers, but it also goes for just using LEDs. You should never treat over a growing fetus over in the pregnant region of a female. I should never treat over known or suspected malignancy. We don't really know the effects of this. Obviously, if you're using lasers or high-powered light, you want to protect your eyes. One shouldn't be treating the thyroid gland directly over it. It can actually increase the activity, although it may be helpful for Hashimoto's or hypothyroidism, but not doing it at home. I mean, what are you, an endocrinologist? No. Okay, maybe you are. Okay, then go ahead. But you need to measure and monitor hormone levels. So you need to see a professional if you're doing that. You know, you're not just going to buy a surgical blade and take out a tumor, right? You're going to go to a professional to do that. Avoid treating actively bleeding tissues. Wait until the bleeding is stopped and you start to have some healing, and then you can use light therapy. And if you have a history of active thrombosis or thrombophlebitis, you shouldn't be using it directly over that area as well. Now, let's talk about medical devices. In Canada, they're classified from 1 through 4. Now, when we go through these different classes, when you get to end of class 1, which is very low risk, then you have what's called consumer products. Now, consumer products is like, I don't know, like an Apple Watch. It's a consumer product. It doesn't make any claims to make you feel better, but it will make claims to say it can monitor, I don't know, your heart rate or other, your skin temperature or, whatever it is you're doing. They're not medical devices. And henceforth, they can make generalized claims, which sometimes gets very cloudy. And because they're not governed under the regulatory authorities, then you know what? They can make all sorts of claims, but they don't have to actually prove anything. In the United States, there's 3 classes, 1, 2, and 3. Now, they have what's called wellness devices, which is similar to consumer products, which, you know, you can have a wellness device and say it does all sorts of different things, but you don't have to prove anything. It's safety, you don't have to prove. You don't have to prove it's effective at all. You can say all sorts of things. And that's why the waters get very muddy, is when you see lots of claims by companies that haven't taken the time or the money or the expenses or the proper manufacturing to make a claim as a medical device. Our devices are class 3 and class 2 in Canada and class 2 in the United States, which means that we follow regulatory oversight for effectiveness, safety, and we report any adverse effects, and we're constantly audited and monitored. That's a big, big difference between something you would just buy off of Amazon. So medical devices, by the way, must not harm those who use or operate them. They should be enhancing the health of patient or the consumer. Compliance with medical device regulations is essential to show the patient or the client that this is true. So device development, design, and clinical studies are all part of the what's called checkpoint framework, as well as quality control like ISO certification and production procedures that every medical device must follow. Okay, so that is really critical if you're planning on getting something that you anticipate on using on your body for a condition. And also things like post-marketing adverse events. For example, sorry, I just something came up there. A mandatory reporting of serious adverse events must be reported by the manufacturer. So this allows for identification of safety issues to take corrective action. You will never see that on devices that are, you know, made by a company that has zero responsibility. That is, they're a wellness or consumer device necessarily, or they're not linked to a well-established medical device company. So the history of BioFlex goes back a long time, and origins from the 1980s by Fred Kahn, who was a vascular surgeon. He had a rotator cuff tendon injury from a skiing accident, was treated by a chiropractor that was using a red laser back in the 80s. This triggered a little bit of a light bulb in the late Dr. Kahn's head, and he went on to do clinical trials, had devices made for him, and eventually brought it to marketplace. And we've now been doing this for well over 30 years. So perhaps now you're intrigued and you think, okay, maybe there's something to this. So now what? Okay, so this is my personal, and I've been doing this for well over a decade, and I've seen lots of different devices. I've tried lots of different devices, and I'm not saying one is superior over the other necessarily, although you need to make sure all the boxes are checked. So for example, use wavelengths that are known to be effective for your specific condition. If I'm treating acne only with infrared light, I'm not going to be as effective. If I'm treating a torn meniscus in my knee only using red light, it's not going to be effective. Use direct contact technique if you're treating a specific injury or condition. That is, you want the device to touch the skin and basically penetrate that light into the tissue. I would never recommend any device that is held a distance away to treat a specific area, because you can't get the dosaging right ever. Dosaging of light is critical. You need to know either the confirmed power of the device, and which, by the way, if you're buying it from a non-medical device company, they don't have to give any accuracy. There's no checkpoint in place for them to actually be accurate. So you never know, unless you happen to have equipment you can check at home. Then you would need to determine the dosage based on time and surface area. which gives you the energy density in joules per centimeter squared. Or to make it a little bit easier, you can use a device with a proven track record of clinical use that has preset dosage parameter protocols that you know are effective. Remember, too much light dosage does not provide better results. Just because you're going to double up the time or sit in front of red LEDs for 4 hours, in fact, you're probably going to go, wow, this is not working at all, because it's dosage dependent. LED panels, yes, there is something to them. And in fact, little hint here, we're going to be manufacturing our own for wellness purposes, for systemic effects on the body, which are good, but a little bit different than trying to treat your torn cartilage or a torn tendon. Remember, red light therapy works on damaged cells, so the benefits like reduction of pain, reduction of inflammation, and healing, they take a little bit of time to manifest. It's not going to happen in 24 hours, right? You're not going to pop in a leave and feel better and go, wow, now I can play tennis. And then eventually 4 months later, you go, how come my elbow's still sore? Because you took the Aleve and you didn't get it properly treated. I know I sound like a broken record. Use a company you can trust that doesn't make outrageous claims and can actually communicate with you for clinical support. If there aren't people there that you can call or email to give you good advice on how to use the equipment, don't buy it. Continue to learn about red light therapy. The more you learn, the more you understand it, the better results you will have. Be realistic with your expectations. In other words, don't just treat a tendinopathy or Achilles tendinosis using light therapy. You need to have rehab. You need to do specific exercises. You need to do eccentric loading exercises. You might need to do shockwave therapy as well. You need to look at other things that are synergistic along with light therapy. And you need to try different dosaging and parameters if you're not getting the results you expect. One size or one type of dosaging or parameters doesn't necessarily fit all. Again, avoid light devices that make just ridiculous claims that you can't really support, okay? Or have a history of selling or designing devices, right? So you want a company that has been doing this for some time. Newcomers like Juve and Kayla, there's all sorts of ones. I mean, I don't know, like I lose track of all these. All they do is they jump on the bandwagon, they go over to China, they have something cheap made for them, and then they make all the claims. It doesn't work that way. They have no understanding of dosaging. They really don't understand what they're doing. And they certainly don't have clinical research trials ongoing. They certainly don't have the use of their equipment by healthcare professionals for decades. They just don't. All right. Thanks for joining me. I will get to the questions. My next webinar is on May the 25th on understanding laser therapy wavelengths and parameters. And if you care to join us in person, we have a live in-person masterclass on July the 8th at the Kingbridge Center up in King City. And this is focused on sports injuries. Anyone can join us for the day. We will actually probably be touching on the release of some of our new exciting light devices, both for consumers, that is for skin rejuvenation, maybe hair loss. I'm going to give a few teasers here. Maybe some interesting LED panels, along with some wearable technology. So if you have a chance to come and join us, please do so. Right now we have an early bird special, full day, including lunch for $149. So you can go to our website to sign up for that. And I see 28 questions. Okay, so please explain how to safely send a unit cross country. Julia, I got your email. Give me a chance. I will respond to that. I did see that, so I will respond to that separately. I mentioned that this is recorded, so you can watch it again on our website, or you'll be sent an email. Can it be used for arthritis on top of the foot, and what settings? I'm not sure who's asking that. If you could email me, david@bioflexlaser.com, I will sort that out, but I need to know what you're using and exactly what the issue is that you're trying to deal with. How do you know when to change intensity levels? Well, that's the thing, right? It's not just intensity, it's stimulation levels, it's power, and it's pulse rate. And typically, you want to start pretty low and then increase those if you're not getting result. Sometimes you need to lower them if you're finding that your symptoms are being temporarily aggravated, which can happen as well. So there's a give and play there. And of course, it may also depend on your stature, your size, your skin color, and your metabolism. So there's lots of different things to take into consideration there as well. Is there a way for light therapy to help a stroke victim? Right. So we've seen some research and we've treated patients post-stroke recovery. We've seen some promising results. There is no guarantee. There is not enough research to say, yes, it will help for sure. May it be helpful? I would say yes. But it's not something you should just be doing at home. What I'd recommend is that you contact us. We have Dr. Randy Santiago, who's our Director of Clinical Research and Trials. You can speak to him as well and get his advice and viewpoint. So potentially, yes, it might be helpful for post-stroke recovery. Does the sauna red light at health clubs have beneficial health effects? How would we use it effectively? Just sit in it for 10 minutes or so. Again, that's my whole point, is that, first of all, saunas traditionally use far infrared because they're targeting water. And there are benefits to that, absolutely, but not like photobiomodulation. Then they threw in red lights and these other wavelengths. And for the most part, I say there's not really much benefit in it because you have no idea what the power is, what the dosage is, how far away you are. Every inch you go away from the light reduces exposure to it. So how do you even know what is you're trying to accomplish? If you want to get beneficial systemic wellness effects, you need to understand how much dosage I should take in. And that's a whole different topic. Once we start to release our own LED panels, I will have webinars and a good discussion around how to use them. Can you talk a little bit about IV or intravenous light therapy and what medical conditions would make a person a viable candidate? Great question. Intravenous light therapy is where you have a fiber optic in a needle inserting into a vein. It can be very effective. But the goal for that is to treat the blood. It's invasive. Our equipment right now is designed to treat a lot of blood, which gives you similar effects to IV light therapy. There's a whole new form of research out there that's referring to what's called intravascular light therapy. And intravenous is one type of intravascular light therapy, but non-invasively, you can also do it if you treat a large surface area of blood. So these types of effects promote a systemic or an immunomodulating effect, and it just depends on what you're trying to treat, whether or not you want to promote that effect. But generally, it's going to produce an anti-inflammatory immune effect around the area. Can the home unit be used to reduce inflammation prior to having gallbladder removal? First of all, I wouldn't do phototherapy or red light therapy before surgery. Stop about a week before, just because it does promote blood flow. I would generally say treat afterwards to help the general area underneath it heal a little bit faster, but it's not going to have probably a direct effect on the gallbladder. So I'm not saying it's treating gallbladder inflammation at all. Can you explain the different levels of therapy with the personal unit? Levels 1 to 4. Elizabeth, I'm going to ask you to go to our website, go to support, go to the personal therapy webinars, and I have several explanatory webinars that talk about the levels 1 to 4, their differences and their importance. I'm just starting to use the device. How do I plan my treatment? My challenge is arthritis, especially in my hands. So again, Anita, I do have a webinar on treating hands with the personal system. So I refer you to that webinar. And if not, you can always email me if you have questions after that. Can laser be used in the same place you just had cortisone injection or methylprednisolone acetate? Good question. Avoid using phototherapy directly over cortisone injection for about 3-4 days, maybe a week, to let that clear out before you use it. There might be a bit of an interference there. We're not quite sure. How soon after knee replacement surgery should you use PBMT and what are the benefits? Generally speaking, within 24 hours of surgery, you can use photobiomodulation. The benefits are profound, from reduction of scar tissue and adhesions to obviously accelerating wound repair and healing, and to promote just in general, faster healing of the post-surgical wounds. Can it help reduce headaches? Again, you're getting into what type of headache. Is it migraine? Is it cervicogenic? Is it tension headache? In general, yes, it can be helpful for headaches, but there's different types of headaches, so one needs to understand that. Can you tell me more about your product and what specific benefits or features it offers that sets it apart from the cheaper red lights on the market? I'm pretty sure I covered that today, Tashish, but if you still have questions, you can always email me. How does red light therapy help fibrotic tissue in secondary lymphedema in the arm? How to use the BioFlex home system for this? So how does it help fibrotic tissue in secondary lymphedema? Well, it's going to help lymphedema by vasodilating lymph vessels. As far as fibrotic tissue, which would presumably have excessive scar tissue, it might reduce some of that collagen in that fibrosis area. But I don't know if it's really going to do a whole lot to alter the fibrotic tissue. However, Anne, if you perhaps email me, I can see if I can help you out with that. Question here, I'm using a P180 for bone hip pain and knee pain. Talk about the unit shutting off because it's overheated. Okay, so the thing about when you're using this, there's a sensor if you're using it. The hip protocol is very long. So what I'm going to suggest is when you place it on one location, you let it air out for a few minutes, maybe 5-6 minutes before you use it on the next location. It happens to be that it's on with such intense light that those LEDs and the electrical current warm up the silicone and it triggers that. So just give it a bit of spacing and make sure it's not covered, that the arrays aren't covered, which will prevent the heat sink from working. I do have a webinar on hip pain, so I'd prefer that you look at the webinars to get information on how to treat these conditions. What areas of the body should the P180 not be used on? Well, to be honest, you can use it anywhere. I would not apply it over the open eyes. That would be the only area that I would say. Of course, it comes with protective goggles if you're using it around your TMJ or your oral cavity or your forehead or what have you. Otherwise, and I also wouldn't necessarily use it directly on male genitalia. That's probably not I don't know what kind of negative effect it would have, but they do use it for spermatogenesis, but it's not designed for that. So I'm going to say maybe avoid that. Do we have to move the probe constantly when we're using the probe, like an ultrasound? If you're referring to the professional equipment, the laser probe is meant to be held statically in one place. Fashish, if you have our equipment, you need to make sure you have done all of the training webinars, because I clearly lay out how you would use a laser probe. If short of time, how effective is treatment if one only uses the red light portion of the treatment that shuts off the infrared portion? Well, the equipment is designed to use red and near infrared, and that's because red promotes more of a systemic and localized, a superficial effect, and the near infrared goes deeper. So if you're using red light just for the skin, I'd say that's okay, but anything deep to the skin, you should be using the near infrared. Any applications for well-being for cancer patients, especially for those who have no hope and do not want to continue down a difficult path? Julia, there's a few things there. You can use it for pain reduction. There's different ways you can use it. I don't know if you'd really have any effect on the cancer itself. More along the lines of helping, with pain perhaps, that kind of thing. But you can email me and I can send you some research on that. Can it be used for receding gums or gingivitis? Yeah, actually, there is some research on because it's inflammatory. Now, our device isn't designed necessarily for that, although we're looking at some devices to design and implement so that you put it in the oral cavity for treating those conditions. Can we use it over a metal implant? Yes, you can. The light isn't intense enough to heat up the metal. Wow, you guys have lots of questions. What is a significant difference between 1 to 4 on the treatment levels? Again, I addressed that in all my webinars on our website. What is a dosage for herpes simplex 2? I can't explain that over this type of format. Whoever asked me that question, please email me, and I can involve more of a discussion for that. Can you place the P180 over a hernia mesh? Yes, you can. Can you go more into detail about laser for infertility? And is there a particular protocol for that? Unfortunately, I don't have the time for that. I suggest that you go to Dr. Lauren Brown, Lorne Brown at AccuBalance. He does educational platform, and he has webinars on, and I've been on a couple of them, on using laser therapy for infertility. When treating with the personal units for multiple conditions on one person, does the number of treatments need to be limited to a certain number of minutes or hours to avoid overdosaging? Overdosaging is one specific area, not multiple areas of the body. I think if that's your question. So you can treat multiple areas like shoulder, knee, back without any risk of overdosing. It's on one area. And because they're preset to turn off at a certain time frame, you should never overdose using our equipment. What's the best way to treat seasonal allergies using the FACE protocol or the general wellness protocol? So it depends if you have what equipment you have, Pauline. I like to use a laser probe over the sinuses to treat seasonal allergies. If you just have the personal system, you could use that over the frontal sinuses and the maxillary sinuses, make sure your eyes are protected using the facial protocol. Yeah, facial protocol or the TMJ protocol. The one that doesn't have the flashing lights, I can't remember which one that is. I think it's the TMJ. For skin rejuvenation, I actually believe I have a webinar on that, Pauline, or at least one on the professional side. So you can look into that. And we'll be releasing some new devices for skin rejuvenation. So stay tuned for that, and preferably come to our masterclass to get a sneak peek on these devices. Or is there any wellness benefit of red light that is commonly used in infrared saunas? I think I covered that earlier about infrared saunas. So the red light in infrared saunas is kind of similar to the LED panels. And yes, there would be some benefit, but you have to know how much dosaging you're getting and how far away you are from it. It seems so simple, but it's not. You need to understand the dosaging. If you don't understand that, there's really no point. You'll probably get too little or you get too much. Would you explain nerve regeneration? Wow. Sorry, Katya, I cannot do that in such a short time frame, but I know there's a webinar on the professional side of webinars under support that I talk all about nerve regeneration and photobiomodulation. What about laser probe on the head, which causes pinching pain when used over the hair? Yes, Saeed, that's a good point. Decrease the power. So you go from 100% down to 10 or 20%, and or use it for less time, because that light can be absorbed by dark hair follicles. It can warm it up. Can you use it for scar pain, keloid specifically? Yes, we've treated many keloid scars, and we have found that it does reduce the volume or reduction, and there's even research to support that as well. Can it heal crepitus? Crepitus is a sign of arthritis. And so, to be honest, unless there's pain with crepitus, I wouldn't worry about it. It's typically a sign that there's some issues going on in and around the joint, but it can perhaps help with it. I wouldn't say heal it per se, because you're talking about a progressive degenerative condition. How do you gain skin contact on hair when the patient is feeling pinching? I'm not really sure about that, but how I put on over the skull or whatever, I'll say the temporalis muscles, I move it back and forth gently to allow the diodes to make better skin contact. Obviously, you don't want to push it so tight or pinch the hair. For neurological conditions, I have done them in the past. You can look on our website for those as well. And I've done master classes that cover neurological conditions, and they're also on our website. A question about getting our devices over to Europe. Yes, where there's a lot of regulatory changes over in Europe. So we're starting to open that up a little bit more, Marie. But Marie, if you contact me, I'll get you in contact with Sarah, who's our account executive for systems for over in Europe. For long-term use, how often should we be doing light therapy? That's a too general of a question. Depends on if you just want for general systemic well-being. I would say it's several times a week. Is a home device suitable for someone who's had a hip replacement? What I would say to that is that it would be helpful. What would be even more helpful is to have professional therapy done. However, it will enhance a long-term healing and obviously ongoing issues in and around the hip and other arthritic. Because if you had a hip replacement, you have arthritis elsewhere. So I would say it would be helpful for that and the other issues as well that I'm sure you would probably have. Cosmetic, oh boy, is promoting an article, 680 nanometers wavelength for hair loss using the Theradome helmet. Should help awareness of light therapy. What do you think of this one? Size fits. Yeah, I know, I've seen it. Yeah, so sure. I mean, it's probably helpful. And by the way, we're going to be releasing a similar one as well. A lot cheaper than Costco. And we know what we're doing better than Costco. Can you use it if you've had cancer or hardware in your back? Hardware, yes. Cancer, you should not apply photobiomodulation directly over an area of cancer. If it's cancer-free, then it's okay. Why don't you ship your devices to Europe? Except for it's a long story. It has to do with the we did before, and there were some changes to the regulatory people over there. So we're in the process of doing it. So we will be able to do that. It just we're getting through all the hoops. Or you can just come and visit us in Canada and bring it back home. Is it possible to get these as a Q&A transcript or replay? Replay, absolutely. Within a week, they'll be back up on our website, and otherwise you'll be emailed one. That's it. Wow, overtime today. I should get paid a little bit extra for today's session. Take care, everyone. See you next webinar.